Dr. Amit, is loyalty dead in modern dentistry? What gives better returns today when we speak about the commercial? It is reputation, investment in technology, better interiors of the clinic.
It must serve our patient. This is the primary goal. This is not meant to be sell. This is meant to enhance the quality parameter of our patient experience.
Dentistry को एक थेरेपी एरिया भी कंसीडर नहीं किया जाता था और डेंटिस्ट्री वाज ग्रोइंग ओनली इन सम ऑफ द सेलेक्टिव मेट्रो सिटीज इन इंडिया. उस समय कहाँ से आई इतनी हिम्मत कि लखनऊ में ही करना है और इस लेवल पे करना है?
Not agreeing on this point कि dentistry metros के लिए ही बनी है. Lucknow also deserve quality and standard.
How do you define a legacy when you turn 70, 80 or 90, which you build for yourself? Do dentists fear with the financial numbers, P&L, system development, or managing the people?
The dentist must ignore the multitasking approach. They should focus on what matters for patient and for himself. Don't try to be a Facebook or Instagram dentist from the day one. This is not practically possible. So just focus on the fundamental.
Hello everyone and welcome to the second episode of Shining Tooth, a podcast where we bring you real conversations from the world of dentistry. At the outset, I want to thank everyone who have watched the first episode and given the overwhelming appreciation for the inputs and the insights which were created over there. It helped us improve. Today we are going to touch upon very interesting topic with a very interesting personality in the dental industry of India. Most people think the dentistry is a solo practice. One chair, one dentist, one city and one practice. And this is how it has been in India for decades. My guest today decided to rewrite this script from Lucknow of all places. Dr. Amit Anand is the founder and principal dentist of Real Tooth today, one of the largest organized dental group in North India. With a team of over 100 people working under one brand, one standard and one vision, which is incredible. 20 years in, a team of 100 plus dentists, a brand that has become the benchmark for premium dentistry in this part of the country. And somehow he's still early in what he says he's building. This is amazing, Dr. Amit. In this conversation, we are going to talk about what it actually takes to build something this ambitious in India, the mindset, the mistakes, the systems, and the scars which nobody is watching out. We will talk about why he bet on Lucknow, how he built a vision that over 100 people now stand behind, and what he thinks the next decade of the Indian dentistry is going to look like. He is part clinician, part CEO, and part category builder. Amazing combination. Dr. Amit Anand, thanks for coming on the show.
Thanks Dinesh for inviting me on this podcast. Thank you so much.
It's our pleasure, sir. So let's dive into the discussion straightforward.
Sure.
एक क्लिनिक चलाने में लोग परेशान हो जाते हैं, स्ट्रगल करते हैं. What I have seen in last 3.5 years of my stay in dentistry, that even taking a small decision in the clinic sometimes take months and year. कैसे करते हैं आप? 100+ डेंटिस्ट हैं, 20 साल से कर रहे हैं, और जब आपने चालू किया होगा तो बहुत से लोगों ने आपको डिस्करेज भी किया होगा ये सब करने के लिए. आई होप सो.
You are right, Dinesh, but actually जर्नी वैसी नहीं थी जैसे लोग परसीव करते हैं. So right now लोगों का देखने का नज़रिया बिल्कुल डिफरेंट होता है कि अच्छा चीज़ें बड़ी हो रही हैं, बिगर हो रही हैं, स्केल अप हो रही. बट मैं इसको अलग तरीके से देखता हूँ. मैं इसको बेटर स्ट्रक्चर डिपार्टमेंट के तौर पे देखता हूँ, बेटर स्ट्रक्चर प्रोसेस के तौर पे देखता हूँ. SOPs हैं, बिल्डिंग टीम, कल्चर और बहुत सारे ऐसे एस्पेक्ट्स हैं जो एक थीमेटिक वे में डेंटिस्ट्री को आगे बढ़ा रहे हैं. सो दैट जर्नी इज समहाउ रॉन्गली परसीव्ड बाय पीपल एज कंपेयर टू कि जो चीज़ मैं बिल्ड कर रहा हूँ बहुत कम लोग ही उसको नोटिस कर पा रहे हैं कि व्हाट इज एक्चुअल बिल्डिंग थिंग. तो मुझे लगता है बिकॉज आई एम नॉट कॉपिंग एनीवन, तो माय जर्नी इज more in the silent manner as compared to being loud. तो ये अब दिखने लगा है, बट इसके पीछे बहुत सारी साइलेंट जर्नी है जो मे बी टाइम के साथ साथ जब राइट टाइम आएगा तो पीपल गेट एक्सपोज। सो मुझे लगता है कि ये चैलेंजेस जो आपके क्वेश्चंस हैं, इससे सोलो प्रैक्टिस से इस जर्नी के बीच इससे डिफरेंट आर्किटेक्चर ऑफ डेंटल इंडस्ट्री एज कंपेयर टू रनिंग ए सोलो शो।
ग्रेट। फाइनल जो मैंने पॉइंट आपसे पूछा था सर, कि जब आपने ये जर्नी स्टार्ट की होगी, सिंगल प्रैक्टिस के लिए बहुत लोगों ने मोटिवेट किया होगा, बट वंस स्टार्टेड एक्सपांडिंग, तो उस समय कहीं से मोटिवेशन ज़्यादा मिल रहा था, डीमोटिवेशन ज़्यादा मिल रहा था?
So actually people are not ready to start collaborating or group practice in India. So we are trained to be a solo pilot.
राइट।
हमें कॉलेज में सिखाया जाता है कि अच्छा ठीक है, जैसे आप अच्छे पायलट बन जाओ सो दैट यू कैन रन द शो एज ए स्पेशलिस्ट, एज ए डेंटल स्पेशलिस्ट। बट पायलट बनने के बाद हमें ग्राउंड लेवल पे एयरलाइंस हैंडल करने दे दी जाती है, बट उसके बारे में कोई एक्सपोजर नहीं होता। सो दैट इज द फियर फैक्टर दैट इज कमिंग इन द फैटर्निटी, बिकॉज वी आर नॉट एक्सपोज विद द राइट काइंड ऑफ एजुकेशन। हम अच्छे डॉक्टर बन जाते हैं, बट अच्छे सोलोप्रेन्योर या अच्छे एंटरप्रेन्योर बनने की जो जर्नी है वो क्वालिटीज नहीं होती। तो इनिशियली लोगों का इनहिबिशन था, बट नाउ पीपल आर मोर अवेयर एंड दे अंडरस्टैंड बेटर। ज़्यादा एक्सपोजर है, ज़्यादा नॉलेज है, तो अब वो इनहिबिशन आज से 25 साल पहले के इनहिबिशन से बहुत कम हो गई है। नाउ पीपल आर एक्सेप्टिंग अस बिकॉज वी क्रिएट समथिंग डिफरेंट।
सर्टनली यू हैव क्रिएटेड समथिंग वेरी डिफरेंट। अब मेरा जो दूसरी थॉट आती है मेरे दिमाग में डॉक्टर आमिर, कि क्यों लखनऊ, जब सारी दुनिया 20 साल पहले मेरे हिसाब से डेंटिस्ट्री को एक थेरेपी एरिया भी कंसीडर नहीं किया जाता था, और डेंटिस्ट्री वाज ग्रोइंग ओनली इन सम ऑफ द सेलेक्टिव मेट्रो सिटीज इन इंडिया। उस समय कहाँ से आई इतनी हिम्मत कि लखनऊ में ही करना है और इस लेवल पे करना है?
सो आई एम नॉट एग्रीइंग ऑन दिस पॉइंट कि डेंटिस्ट्री मेट्रोज के लिए ही बनी है। लखनऊ ऑल्सो डिजर्व क्वालिटी एंड स्टैंडर्ड। तो और दूसरा एस्पेक्ट ये है कि लखनऊ के अंदर एज ए टीयर 2 सिटी जब हम लोगों ने चीज़ों को स्टार्ट किया था, दिस सिटी इज मोर रिवार्डिंग। People trust on you, they accept you, even all tier 2 city as compared to any metro cities.
Okay.
So here you can play your game in a longer run without much disturbance or disruption. So मुझे लखनऊ के लोग भी पसंद हैं, और उनके साथ जो जर्नी मैंने जी है, लोगों का बहुत ही अच्छा सपोर्ट रहा है। और as compared to metro cities जहाँ पे मेरे दूसरे कलीग्स हैं, they are also doing good. बट इस शहर ने मुझे ज़्यादा स्कोप दिया प्ले करने का, और एक स्लो पेस की वजह से मैं ज़्यादा यहाँ क्रिएटिव वे से अपनी ऑर्गेनाइजेशन बिल्ड कर पाया। एंड नाउ वी आर रेडी टू मूव अहेड इन अदर टेरिटरी, और जो आने वाले 5 ईयर के हमारे गोल्स हैं, तो उसमें वो चीज़ें भी हम लोग अचीव करेंगे। बट दैट इज़ गुड सिटी टू स्टार्ट, एंड आई जस्ट अंडरस्टैंड विथ ऑल द मार्केटिंग रिसर्च पॉइंट एंड बिजनेस रिसर्च पॉइंट, next 10 year this healthcare sector should be boom in tier 2 cities. tier 1 सैचुरेट हो चुका है, tier 1 में बहुत स्कोप है, और somehow after 20 year I realized कि I take the right step at the right time, और जिसका रिवार्ड मुझे ऑलरेडी
मिल रहा है। So that was an accidental step or that was a thoughtful step? ये
भी एक बहुत अच्छा क्वेश्चन है। when I reflect on this, so I just found it a start from not accidental, because I was staying here. So I start my journey over here. I got many opportunity to settle in abroad also, in the other cities also. People call me कि अच्छा आप मुंबई आ जाओ, दिल्ली आ जाओ, इवन यूके से कई सारे कॉल्स वगैरह है। बट डिसाइड कि नहीं, ये शहर में मुझे अच्छा पेस मिल रहा है, एंड लोगों से जो अपना रेपो है वो तेज़ी से डेवलप हो रहा है, एक अच्छा ट्रस्ट बिल्डिंग हो रही है, टीम डेवलप हो रही है। सो मैंने भी सिस्टम पे ट्रस्ट किया, अपने प्रोसेस और थॉट प्रोसेस पे, अपने विज़न पे ट्रस्ट किया, and somehow it works well.
You sound very humble, but there are not many Amit Anands in many of the tier 2 cities across the country. So just I want to understand more that why there are not many Amit Anands who are thriving in the tier 2 cities or tier 3 cities, which is certainly a growth engine for the next 20 years. But when you started, I don't know whether we were thinking about tier 2 cities the same way.
Somehow I see lots of Amit Anand in the market from my time to this new generation time. One gap that I feel that is a lack of mindset only. There is a huge talent in the market, and they are better exposed from my time. They are better amenities, better tool, better technologies, and better information also. But what is lacking is the patience and the mindset. I think we should, if we work on the mindset part, definitely you will find 100 times more Amit Anand than what you can see.
I believe so, since the market needs many Amit Anands, and tier 2 and tier 3 cities are the next growth engine for the country, not only in dentistry, all healthcare areas and across the industries. You have spoken about the patients and you have spoken about the mindset of the dentist. What is the biggest challenge for you? Convincing patients about the dentistry or convincing dentists about your vision when they come and work here in the team?
This is very secret question, so but I love to answer that at this moment. So it is always tough on dentist part. Patient treatment modalities has been same across the year. Only tools and method have changed. But as far as fraternity is concerned, the mindset, again, the mindset part is big game. We are developed to play our solo game from our colleges and alma mater. But now the patient demand has changed drastically since last 40 years, 25 years. In last 10 years is disruption. So are we ready for these kind of patient need related disruption market? We need to change our methods also. So now the complex treatment cannot be done by one people, and this entire dentistry need to be more organized. So now in future you will find there is a two way of dentistry, organized and unorganized, and we need to decide in which segment we should land. So scope will remain same for both the prototype, but future is organized dentistry, where the patient need and demand need to be taken care in a holistic manner, not in a very discrete manner.
This is very deep. You have given your secret sauce here. And when I just contemplate, I was just hearing you out. I was thinking aloud. India produces close to 30,000 dentists every year. Is our dental education system producing just degree holders or skilled professionals?
So much of dentists that you are producing in India is still lesser than what we require. The main change should be into the right direction of modern dental patient need. They want, now dental patient want not only treatment, they want better experience also. So entire dental fraternity should look on the overall patient satisfaction and experience, not only the treating the patient just like a dummy or model. And people are changing. Now what we were taught in 10 year, 15 year back, things are changing, and might be next 5 years you will see the changes.
So then this gives a perspective. Is it like contemporary time is more for the dentists who are just skilled, or for the dentists who are skilled plus having a high level of the emotional intelligence or soft skills for that matter?
Emotional skills are still very valuable for long-term success. Any kind of qualification that has a capex, you can achieve those kind of qualification whenever you want to start within 10 years of time. This is gold standard. 10,000 hours in one direction, you will get Olympic champion level skill set. But emotional intelligence is a continuous journey. You have to go through across the life, because every 10 year, every 15 year, things are changing. You have to blend yourself as per the patient, industry, and other social needs and financial things that were changing very rapidly, even in our country, that is transition from the developing to the developed country. So this next year is going to be a big change in all 360 aspect of the profession. People should focus on both, but emotional intelligence is the main factor for long-term success.
So we have spoken about the patients as customer and emotional intelligence, which will play along with the skill set. Do you see a shift in the patient behavior while considering dentistry as a treatment option?
Definitely, and it is going in the right direction for dentists. People are saying this patient perceptions and demands are changing. That's good for industry. As a early mover, it was big challenge for me 20 years back when technologies and other deliverables are not aligned with the patient expectation. Now we are fully aligned. All the information, modern tools and facilities are there. We can easily nurture the patient. One thing that we need to change is our prospect to seeing the dental treatment process, what we are taught in the college and what which is expected by the patient. For me, I'm just always looking for 10 year ahead. What patient should think after 10 years, we should be well equipped right now to nurture those needs. So this is my way, but at least this is my call to all the dentists who are seeing this podcast is to continuously evolve yourself for the need of the patient. And the patient is the only factor who decide your future, and get connected with the patient need. Note it down, reflect it on the patient need. It is not about at this time we are able to deliver it or not. Maybe we should equip ourselves in terms of education, knowledge, and which course we should attend. Right now, when I go to any international level courses from good top companies, there is sessions of practice management, how to do digital dentistry, how to communicate about our process to the patient. And that is very much lacking in our system. We need to develop those kind of skills where we can communicate better to the patient and vice versa. We should understand the patient need also.
Yep. This is very pertinent, and I see a very important piece whenever I connect with you. Your most of the thinking alignment is around dentistry, right? Wherein the second set of the dentists who are doing a lot of aligners, implants, everything, and everybody is making good commercials out of it. However, your big chunk of the investment goes in on the training for yourself and your teams. Is it really important when others are not doing? Why are you doing so?
So, Dinesh, you are also globally traveled. This is the fundamental recipe for growth. So, we are mostly investing on ourselves, but you have your own capex. You should invest on your team so that they will replace you. Replacement word should be in the positive direction. It should not be the negative direction.
Yeah, I was really scared. So, who will create the replacement for themselves?
Then how you will grow, how you will reach to the next level. So investment in a proper direction, in a thematic way, in a strategic way is always give you lots of scope to expand. Along with that, your next level team, next level leaders, you have to develop lots of leaders inside your organization, and you should nurture them to become a good leader so that they can also develop their downlines. So this is the recipe that I learned across the globe with the big universities also. And somehow I am able to open up my mindset to invest on me, on the personal level, as well as my team.
That is a very beautiful perspective. Means you are preparing for the next 10 years, and you are not only developing yourself, you are developing the entire ecosystem so that there should be the holistic growth.
Yeah, and the sustainable also.
Yes, yes. Now let's deep dive into your journey, right? तो सभी से पूछता हूं मैं, और आपसे भी पूछूंगा कि आपने डेंटिस्ट्री को चूज किया कि डेंटिस्ट्री ने आपको चूज किया?
मेरे टाइम में सारी चीजें बड़ी डिफॉल्ट होती थी. मेरे टाइम के जो बच्चे थे उनके पास लिमिटेड ऑप्शंस थे. तो डेंटिस्ट्री वाज सेलेक्टेड एज अ डिफॉल्ट.
Okay.
But when I come into the patient part of dentistry, then I realize it is not only treatment, not only to heal the patient. Dentistry give you a scope when you can see your work immediately or even in very short period of time, and that allow you to reflect your creation in the patient, and that open up, that ignite my mind. Okay, this is the craftsmanship that I am doing on every patient. And that is very unique factor that I imbibe, and that increased my interest into the dentistry. So I feel I am a doctor. I feel I am an artist also. And with the modern dentistry, with lots of digital tools, AI, CNC machine, 3D printers, even integration of lots of software, I feel like an engineer also. So that is the three combination that I'm really living in day-to-day life. So my journey from the default, and right now I'm fully enjoying the entire profession from start to end.
Great. Doing what you enjoy is the biggest bliss.
Yeah.
And fortunately, you are having it. You started your journey around 20 years ago. उस समय सक्सेस के क्या मायने होते थे डॉक्टर साहब आपके लिए?
So जैसे मैंने बात करी कि डिफॉल्ट फॉर्म में सक्सेस मीन्स रनिंग योर ओन क्लिनिक, यू हैव बिजी प्रैक्टिस, आपके पास जो भी आपके वर्किंग आवर्स है दैट शुड बी फुल्ली ऑक्यूपाइड, बुक्ड. इवन फॉर मी इट शुड बी, I should be booked for next 2 months, 3 months, because I work with lots of international people from my early days. I just found their appointment is booked for 2 months, 3 months. उससे पहले अपॉइंटमेंट्स नहीं मिल सकता. तो मेरी भी यही एस्पिरेशन थी कि मेरी प्रैक्टिस भी ऐसे हो 3 महीने तक डॉक्टर अवेलेबल नहीं है. बट when I grow in the practice, then I realize the challenges are entirely different, and we cannot implement those kind of European theme in Indian industry. Then I think, okay, ठीक है, there should be the Indian version of this kind of ambition. That's how I create Real Truth, in an Indian version of those things, where I just invest on my team, my infrastructure, and developing my processes and other things. तो जिसकी वजह से एक Real Truth slowly एक certain parameters तक big हुआ, and now it is growing bigger and bigger. So that is the journey from single clinic mindset to the enterprise mindset.
Yeah, this is a very beautiful perspective. Means you started with the thought process that you should have at least appointment available after 90 days or 3 months. It still might be your bandwidth is not available, but somebody is available to attend the patient.
Yeah, definitely.
Right?
Definitely.
You have changed the perspective here and the dynamics.
Definitely. And that is need of the hour. I selected to stay in India. So I have to develop those kind of creative thing, creative process, creative business model for Indian dentistry.
डॉक्टर साहब ये बड़ा अच्छा पर्सपेक्टिव है कि हम लोग देखते हैं उसको रिप्लिकेट करना चाहते हैं. जैसे सक्सेस अराउंड 20 years ago would be the same today as well.
Yeah.
A new graduate who comes out of the college, he wants to start his practice, he wants to have a good clinic, good running clinic where patients are waiting for him, and he is occupied morning to evening, right? The aspiration has not changed. Then what is the big change you see today?
Patience. They should have more patience. They should invest on understanding the industry parameters. And they should also understand the learning curve of running a dental clinic. I hardly found any book in Indian market who talk about running a dental practice very smoothly.
हाँ, वो मेरे दिमाग में भी आ रहा था कि कोई कोर्स ही अवेलेबल नहीं है इसके ऊपर.
So from 2010 and 11, when I start moving to European countries, I bring lots of books. Practice management, how to talk to the patient, how to convince the patient, or maybe how to make the treatment plans. We understand, we guys are good enough to behave like a doctor. So we should act like a solution creator for the patient, not like a robust doctor. So these changes that is very much required. Not think like a traditional doctor. You should just behave like a solution provider. And patient wants solution. They need end-to-end solution. That is the change that young dentists can definitely think on those aspects that will definitely help them to grow their practice, whatever level they want to grow. And they need to select their segment also. You cannot capture the entire market. You must have your 1% audience in all the branches of Real Tooth, we expect only 3 to 4 new patients per day. And that is more than enough to keep engaged the entire branch, entire big branch of 6-7 chairs set up to engage those things. Because we have old patients that need to nurture. So just focus on quality, not on the quantity, and try to finish whatever you started.
That is a beautiful perspective. It is not only about the patient recruitment, it is about giving them a great experience where you can leverage their lifetime value. डॉक्टर साहब जर्नी आसान तो नहीं रही होगी, चैलेंजेस रहे होंगे, कुछ चैलेंजेस शेयर करना चाहेंगे?
सबसे बड़ा चैलेंज कुछ बड़ी चीज़ों को बनाने में ये होता है, यू विल फाइंड योर सेल्फ एलोन इन द एंटायर जर्नी. So although as a leader I develop myself, my team, their team, entire funnel is ready. But your department head understand your department, your HR understand your part, your other team, other department understand their role. There is nobody, even your family understand that you are busy, you are exhausted. But nobody understand, see what you are seeing. At the top of the funnel, my horizon is so big so that the other people cannot see. Where you will find yourself entire alone in the journey. I feel really bad about certain aspects. But I think this is the price of being here. And most of the circumstances, right now, I learn how to enjoy this loneliness across the time. So that is the big sacrifice, and definitely there are lots of time that I think, okay, बहुत हो गया. But every time when I see the lots of people around me who is doing pretty good in their career, that makes me again my adrenaline flow, adrenaline rush will increase, and then I found कि नहीं यार कुछ और करते हैं next 5 year और. So initially next 2-3 year में ऐसा होता था कि चलो बहुत हो गया, बहुत चीज़ हो गई, एक बड़ी क्लिनिक हो गई, बड़ी टीम हो गई. So next. Now after 10 years, okay, नहीं ये जर्नी तो खत्म नहीं होनी है. This is the part of journey, and now I am also enjoying those prospects. And thankfully I am surrounded by good people in my industry, in other industry also. तो उनको देख के लगता है नहीं ये तो बहुत ही छोटे लेवल पे अभी हम लोगों ने काम किया है, and that keep me going. So right now I am mission of building at least 500 dentists in my lifetime. That is my mission of the life. It is not about the building something extraordinary. It is more about the building more people like me, and at least I can make their careers.
I'm seeing around, there are many people who have been trained in your clinic. First thing, they get the exposure to the best of the technology. They are starting up their practices, not only in tier 2 cities, they are going to tier 3, tier 1, everywhere. And that is very much visible. You speak every time that you want to create 500 Amit Anands. So what is behind this 500 number?
Initially my goal was 100, but I am really very close to that.
Okay.
And I have another 20 years to play.
Right.
So I just changed my benchmark. So that is the inhibition. So in one of motivation session in a dental fraternity, I remember his word. So as a dentist, whatever comes in back of the mind, when it coming from here to your tongue, it decrease.
Right.
So suppose we have to say 1,000 rupees as your service charges to the patient. We think 1,000. When it come to your tongue, it reduced to 200 or 300. तो मुझे भी ऐसा लगता है कि पहले शायद मेरे साथ ऐसा हुआ होगा कि मैंने 1000 सोचा होगा, यहाँ आते आते जो वो 100 हो गया. But 100 is almost we are going to achieve this number by this year in terms of dental. So maybe next 20 years I can do 5x from here.
Yeah, certainly we'll do more.
Now we have experience, we have infrastructure, team stability, and there are other way also. 20 years back, I have limited resources, limited reach. Now I can reach to the many people where I cannot be available on my physical form. So that is the blessing of this time.
The technology will enable you to
From
reach out.
analog to digital world, that is building the experience. This time zone is a blessing for next 20 years.
Yes, certainly. What we are discussing here, that will go live on the system.
Definitely.
And once it will go live, that many people will watch it and they will certainly get benefit. You mentioned once you got success, that हो गया सब चीज, थोड़ा relax हो जाते हैं. That was after getting success. But when there was challenging time initially, did you feel like any point of time कि यार बहुत हुआ, छोड़ो इसको, कुछ और करते हैं?
ऐसा हुआ नहीं actually, and this is the most important aspect when I reflect back from this point. So मेरे पास कोई प्लान भी नहीं था, और कभी इस तरह की बहुत मतलब बिजनेस साइड का एक्सपोजर भी नहीं था. When I meet lots of people और मोटिवेशनल स्पीकर्स एंड लीडरशिप कोचेस, सो आई थिंक कि यही सबसे बड़ी ब्लेसिंग थी. आई नेवर हैव प्लान बी. आई हैव वन थिंग टू गो, दैट इज डेंटिस्ट्री. सो प्लान बी कभी था नहीं. एग्जॉस्ट भी हुए, फिर भी रेस्ट किया, रिकवर किया और वापस अपने काम में अपनी डेंटिस्ट्री पे ही लग गए. दैट इज द मोस्ट एडवांटेज पार्ट of my thought process or my mindset somehow, you can say in the positive direction or negative direction, but this is the recipe.
This is really a biggest virtue. लेकिन क्या चीज रोज उठ के और वापस आने को मोटिवेट करती थी डॉक्टर?
Initially in struggle phase you work for survival. Survival के बाद struggle phase आया, struggle भी होती है. Now in your journey, when you find there are almost 100 people working with you to overcome this struggle period. Now, as a gratitude, I'm working for them and planning to develop more team and want to work for them till my last day. So,
this is a big statement.
ये एक cycle है.
This is a big statement.
So, this is the karma cycle. ठीक है, फाइनेंशियली सक्सेसफुल होना बहुत इजी है. लोग जैसे यूरोप वगैरह में अर्ली स्टेज में अर्ली रिटायरमेंट चाहते हैं, बट मुझे लगता है रिटायरमेंट क्यों चाहिए? क्योंकि जो रियल सक्सेस है, दिस इज नॉट अबाउट मतलब अचीविंग सर्टेन नंबर. रियल सक्सेस इज ऑल अबाउट द कंटिन्यूअस जर्नी विच यू कैन पास आफ्टरवर्ड. मतलब आई एम बिहाइंड द मेकिंग दोज काइंड ऑफ लिगेसी बेस्ड ऑर्गेनाइजेशन, ना कि वो चीज़ें हमारे साथ या एक सर्टेन टाइम के बाद खुद ही ऑब्सलीट हो जाए. इट शुड रन आफ्टर मी ऑल्सो. सो दैट इग्नाइट मी एवरी डे कि सुबह उठ के 5 बजे से उठ के अपना कुछ काम करना है. आज क्या करना है? आज किसी 3 लोगों को कि लाइफ में कैसे कोई चीज़ चेंजेस लाने हैं. सो दैट इग्नाइट मी एवरी डे.
जो आपकी थॉट प्रोसेस है डॉक्टर साहब, दिस इज लिटिल अनयूजुअल. अधिकतर लोग क्या करते हैं कि कॉपी पेस्ट किया, ये क्लिनिक चल रही है, इनकी तरह बन जाता हूँ, इनकी तरह बन जाता हूँ, इनकी तरह प्रैक्टिस कर लेता हूँ. कई बार आपकी सराउंडिंग में लोग आपके एम्बिशन को लेके परेशान नहीं होते, थोड़े से अनकंफर्टेबल नहीं होते, और दे आर नॉट एबल टू अंडरस्टैंड व्हाट यू आर थिंकिंग अबाउट. बहुत से लोग ऐसे होंगे, मेरे को लगता है.
डेफिनेटली होंगे, बट एंड दिस इज पार्ट ऑफ योर जर्नी. तो मुझे लगता है कि जब भी, जहाँ तक कॉपी की बात है, यू शुड बी ए गुड कॉपी कैट. हम लोग कुछ भी खुद, सारी चीज़ें जो भी हम लोग यूज़ कर रहे हैं खुद से नहीं डेवलप करें, सो डेवलप बाय समवन एल्स एंड वी आर एक्ट लाइक ए कंज्यूमर. तो सेम वे यदि कोई चीज़ अच्छी है तो उसको हमें कॉपी करना चाहिए, बट वो थीम, उस थीम को मैच करना चाहिए आपके थीम से. तो जस्ट लाइक जैसे मैंने कहा कि मेरे एस्पिरेशन में ये था कि इनिशियली कि मुझे 3 महीने मेरा अपॉइंटमेंट बुक होना चाहिए. ठीक है, आई शुड वर्क ओनली फॉर द 10 पेशेंट. सो क्रिएटिव, सो आर्टिस्टिक वे. बट वो इंडियन सर्कमस्टांसेस के हिसाब से फिट नहीं हो रहा. वी आर ब्लेस्ड विद लॉट्स ऑफ पॉपुलेशन जहाँ पे लोगों को ज़रूरत है, जहाँ पे क्वालिटी प्रैक्टिस की ज़रूरत है. अब ऐसे सर्कमस्टांसेस में मुझे लगता है कि मेरी रिस्पॉन्सिबिलिटी ये होनी चाहिए थी कि हम इन चीज़ों को मैक्सिमम लोगों तक कैसे पहुँचाएं. तो आई जस्ट ट्विक माई विजन, कॉपी किया, बट उसको अपने थीम के हिसाब से मॉडिफाई किया. तो जो भी लोग हम लोगों को फॉलो करना चाहते हैं या कर रहे हैं या एस्पायर हो रहे हैं पॉजिटिवली और निगेटिवली, उनको अपनी थीम पे फोकस करना चाहिए. व्हाट टाइप ऑफ सिस्टम, स्ट्रक्चर, प्रोसेसेस, एसओपी दे आर बिल्डिंग फॉर देयर क्लाइंट पूल. तो हमने अपना क्लाइंट पूल की जो निच है पहले से सेलेक्ट कर ली कि वेयर वी नीड टू प्ले. और डेफिनेटली जहाँ तक फिलेंथ्रोपिकल वर्क की बात है, वी आर ऑल्सो डिलीवरिंग दोज काइंड ऑफ वर्क. जब भी कोई चीज़ ऐसी सिचुएशन आती है तो वी कंट्रीब्यूट इन दोट पार्ट ऑल्सो. तो आने वाले विजन में वी हैव सर्टन लेवल ऑफ अदर प्लान्स की जहाँ पे हम लोग और ज़्यादा अच्छे लेवल पे नीडफुल लोगों तक अपनी चीज़ों को पहुँचा सकें. तो मुझे लगता है दिस इज़ गुड पार्ट कि लोग आपको देख रहे हैं, फॉलो कर रहे हैं पॉजिटिवली और निगेटिवली, और उसी के साथ कुछ ना कुछ तो ग्रोथ भी साथ में लेके आएंगे. तो दैट ऑल्सो मेक मी हैप्पी इंस्टीड ऑफ फीलिंग कि अच्छा ऐसा क्यों हो रहा है. सो दैट इज पार्ट. शुरू में लगता था, अब जैसे जैसे मुझे लगता है कि थोड़ा सा अर्ली 40s में थोड़ी समझदारी बढ़ रही है, तो मैं उन चीज़ों से थोड़ा सा उठ रहा हूँ ऊपर. तो दैट इज गुड पार्ट ऑन माई पर्सनल वेल बीइंग. तो थैंक्स टू माई पेरेंट्स कि जिनके संस्कार ऐसे थे, एंड माई कोचेस जो मेरे माइंडसेट को इतना ब्रॉड बना रहे हैं कि ओके मतलब इन चीज़ों से कुछ मतलब अच्छी वाइब ज़्यादा आती है एज कम्पेयर टू नेगेटिव वाइब.
ग्रेट. फैमिली सपोर्ट कितना इम्पोर्टेंट रहा है आपकी इस पूरी जर्नी में डॉक्टर साहब? क्योंकि पागलपन तो है, और पागलपन हर चीज़ में है. इन्वेस्टमेंट हो तो बेस्ट इन क्लास, ट्रेनिंग हो तो बेस्ट इन क्लास, पेशेंट एक्सपीरियंस हो तो बेस्ट इन क्लास.
So I am really thankful to God. So I have two families. One is a personal family. My parents, उनके जो guidelines शुरू से रहे. My wife, my childrens, they have always been so supportive. और दूसरी फैमिली है मेरी टीम. सो आई वाज ब्लेस्ड कि दोनों से हमेशा एक्स्ट्राऑर्डिनरी सपोर्ट मिला, और जिन्होंने मेरे पागलपन को झेला भी, सहा भी, कई बार मुझे पैम्पर करने की कोशिश भी करी. तो मतलब आई डोंट नो देयर एस्पेक्ट, बट आई एम रियली ब्लेस्ड. तो बिना उस फैमिली सपोर्ट के यहाँ तक पहुँच पाना मतलब इम्पॉसिबल था.
ग्रेट. वेरी एक्साइटिंग जर्नी डॉक्टर साहब. अब नाउ वी विल स्पीक अबाउट योर डेंटल सर्विस ऑर्गेनाइजेशन, एंड इसके अराउंड क्या क्या चीज़ें आपने की हैं, कैसे इसका इम्पैक्ट है कम्युनिटी पे, सोसाइटी में. विल डिस्कस डीपर इनटू दिस. Most of the dentists want freedom rather a system, and it is always, you also told that dentists are trained in a way to single chair, single dentist, single clinic, and solo practice, wherein in the contemporary time, as you mentioned, that patient outcomes can be improved with the teams, not with a solo dentist. How to bring the people together who are not trained to work together? And you have been doing it beautifully. 100 dentists under a roof, working in tandem. How?
You have to select the right people. There should be no scope of dentist related ego in your ecosystem. So I think I selected right people who is more patient oriented as compared to self ego oriented. So only the dentist ego come into the place when doctor is saying okay they have those kind of degrees. But my question is always how that degree is going to help your patient. So your skill set should be valuable for patient, not for you. So if I found doctor who is well oriented, despite of that their skill set is slightly lesser than the other people who have more ego, I always go for those kind of people, because I know after certain time, certain level of training, I just lift their clinical skill bar, but they cannot, but I cannot change their mindset bar. So right kind of people is very important for my organization in terms of just focusing on the culture. There should be 3 win in our organization. First win should be the patient should win first, second is team should win, and last organization should win. So 3 win is our core values. I always stick to that culture.
Beautiful model. 3 wins. First is the patient, second is the team, and third is the organization. Very well prioritized. You are ahead of your time. You are still ahead of your time. You plan for the next 10 years. When we were speaking in morning, IDS is scheduled in next year in March, and you're already booking hotels, which company to meet, how much time to invest on which booth. This is a meticulous planning well in time. Now, were you ever fearful that expanding the organization to this level, hiring this many people, is putting you into many risks, or you were sitting at a dichotomy whether I should take this risk or not take the risk, or you're so much convinced about it?
So I already taken lots of risk when I had nothing. At this point, those risks are very smaller because I know how to build a system. If I know how to build, so there's no risk in investing in terms of financial. This is more about risk should be more related to the industry, people mindset, in terms of patient, in terms of our doctor. At this point, I think I'm in well balance of both technology and my people. So all the financial investment, financial risk, I know how to build a system. I think I will manage all those things. So right now I'm in more peaceful condition as compared to 15 years back, where I was more accountable on the financial outcome part also.
I understand your perspective that you have reached to a level where experimentation will give you kick, and you want to give more to the community than rather squeezing for the community from the community.
And we never want to become so big. We always want to become more sustainable. So sustainable, when our focus is sustainable, not become chasing some numbers in terms of number of clinic, in terms of number of doctors or maybe patients. We are focusing on more sustainable growth. So if the focus is sustainable, all the risk has been pre-calculated.
Scaling up in any organization gives a lot of opportunity. At the same time, there are pitfalls also.
Yeah.
So when the organization grows, what breaks first? Is it quality? Is it a culture? Or is it cash flow?
For me, culture. Cash flow can be managed if you are well planned. Quality can be managed with your processes, system, SOPs, audit, quality controls. But culture, their reflection you cannot see from the day one. One wrong hiring, one wrong team member, one wrong people inside the organization, you will see that is going to dent you after 6 months, after 1 year, after 2 years. And that is the main part. Most of the energies goes into the maintenance of the organizational culture part. So, and most of the people don't understand why culture is very important. Short-term spike in the growth is not sustainable. That's why I always focus on sustainable growth, not in the aspirational growth. Both the processes, cash flow and other things is well managed, well planned, and we have lots of backup for those things. But the culture part, it is going to be highly non-negotiable day by day.
Perfect. Then recruitment becomes somehow very important for you. So what are 1 or 3 parameters which are certainly non-negotiable while identifying the right candidate for your organization?
So I really focused on mindset and attitude of the people. The rest, everything can be built simultaneously. So we have different set of program for onboarding, just like for the freshers, we have different set of program. For the specialists, we have different set of onboarding program. I personally coach them, and we have our own training education system where we can involve those kind of new talent, merge with the old talent. So the amalgamation happens very fast. So that is our recipe. But apart from that, the mindset and attitude is the right factor that definitely reflect in long-term culture of the organization. I think with the hiring part, this is main parameter where we judge.
एक मछली सारा तालाब गंदा कर देती है. And doctors are considered next to God when it comes to treatment, right? However, they are having the ethical issues. When a dental service organization grows, does ethics are also become kind of a core topic to be watch out?
Very valid question. For me, I'm I found myself a good observer to lots of people who is already in top leadership, and they are doing well throughout the career. I just found one thing very common among those people. The ethics is most of the time on the personal level. This is my ethics. This is your ethics. We should always talk about our organizational ethics. When my ethics work for me, and that is validated and tested by lots of already successful model across the globe from the other industries also, we make it as a strong non-negotiable part of the organization. So now the personal ethics is now the organizational ethics, and that is non-negotiable. So that is the beautiful thing that eventually help us to gain our core values. That is the win-win thing. The doctor should also win, but before that, patient should win first. So that is the ethical part. As a doctor, you should allow or you should work till that level where you are not going to harm your patient. So that is the ethical part. We had make it non-negotiable for all the leaders, including me also. So I think this must be your answer.
Yeah. So what I understand, the systems and the processes are so robust that everything is balanced, everything is watched out, and culture takes priority on everything as a driving force.
I think in dental fraternity, both should go simultaneously.
Okay.
This is the internal part, this is the external part. And at least we cannot be very much rigid with our certain process, because all the patients have a different model, and that we need the customized approach for each and every patient. So at least 70 to 80% checklist should be done. Next 20 to 30%, that call has to be taken on the ethical part. So that is the amalgamation of both the factor. Myself and my second line, my third line, they have responsibility to fill that 30% gap till the time a new talent come to us and get amalgamated with our flow. Then that is the gap our leaders fill, and rest 70% or 80% take care by our system and processes.
Great. You have given a good perspective here. Now, on the DSO side, the last piece, where do the future belong to? Solo practices or DSOs or the group practices?
Whatever my exposure to the global level, I just found everything is going to be organized. Organized means you have to be work in a group. So solo practitioners, definitely they are also growing, but from my point of view, that is not an end game. So you have to move your boat into that direction where this kind of infrastructure, this kind of collaborative work will be the future. So my request to all those
patient needs will drive the structure of the organization.
definitely, you cannot serve everything. You cannot serve everything. I realized this gap almost 20 years back, so that we reached this level. So my request to all young dentists, they should focus on this kind of patient-related need-based shuffle from solo dentists, which has been taught by our dental schools. But that was the old model. School always taught you the old thought process, the historical aspect. Now you come into the practical aspect. You should always look to those people who is ahead of the market, or whatever the other peoples are doing across the globe, and what is the success model. Just focus your lens from this side to this side, you will get your answer. And everything is nowadays available on internet, or all the details are available in YouTube and other things. You can go learn and self-realize yourself instead of just following or copying something blindly.
You have given a lot of insights so far. Your favorite topic, the next segment here, the human resources, leadership, and team building. Large team, 100 dentists under a roof, committed to single vision and mission which you have created. How to attract them to just get driven by this vision of yours?
Still, this is the big challenge. And as I told you, I just always focus on culture part along with that people development part from my side. But it's still a very tough task. I don't know. Maybe this is not a lack of talent. It's all about with the Gen Zs, lots of things are changing in terms of their attention span, in terms of their aspiration of very early success. It's not early, it's very early success. So that is not practically possible right now. That is a big challenge. So almost after screening of 200, 250 dentists in a year, we hardly able to select 20 or 25 out of them. This is the present challenge.
Do you make some hiring mistakes?
I did it. For me, we should reach that level almost 10 years back. But somehow, some mistakes, because I'm also a born dentist, not a born entrepreneur. So somehow, due to my aspiration, I just learned lots of things with lots of mistake, because we hardly have any guideline from different business background people. I come from a very humble doctor background, so we have no exposure of business and other part. But I invested on my learning. That's how I did lots of mistake in terms of financial part, in terms of managing my books and other things, along with the hiring part. The philosophy that need shift, and somehow by collaboration of lots of good people in my life, so they help me out to understand what's going on, and somehow we reach to that level. But definitely mistakes are there.
I have seen in many of the clinics and some of the DSOs, there is a lot of churning of the dentists. People come, work for 2-3 months, and they leave. Early, say, people leaving within 2-3 months is little surprising. What might be driving those exits?
Why you are thinking that this is bad? I just found you this is good. We have courtship time to understand each other. So that is good, no?
You change the perspective here.
Yeah. So 3 months is a good time. Even I just think that 1 year is also good time. At least we had some time together. And if we are not married for longer goal, at least we separate. Instead of giving alumni. So I just find it in a very positive way.
You explained it very well. I never thought that this will be the...
This is not challenge. This is the blessing that, and my duty as I just found it a different type of visionary person. So in this 3 months, at least my organization should touch them in such a manner, at least after leaving us, they should do something good in their life. So that is the value addition I always want to impart during that 3 months or even 6 months. So that is my duty, giving back to the society that I am doing.
Coming to a point which we discussed earlier, the ego of the dentists, right? Once anyone grows in terms of skill, capacity, capability, I believe the ego also grows. And you have a large organization. Many people are staying with you for years together. And they have grown in capacity and the capability, and certainly some part of the ego. How do you manage at least the leadership team where the ego clash is very much possible?
Somehow in our organization, this is not so big from my prospect. Still people are interacting with each other, and our entire energy go into adaptation of the new system and the processes. So every 3 years, we change our entire processes because the new technology has already arrived. So our entire energy, leadership energy goes into the unlearn and relearn process instead of just saying, okay, I already learned. So my duty is to bring lots of innovation and technology so that they get engaged in unlearn and relearn, and their learning path should not stop. That is the point where I did well. That's why in my top leadership, there's hardly any ego.
Means you are blessed if that is not there. And but I believe in many organizations, people might be struggling with the ego clash of the leaders, right? Very important piece here. As a founder, right? Can you scale up the organization without building the leaders?
No.
If not, then how do you find the leaders among these many number of the dentists who are there?
So I see many corporate organizations where they hire top leadership. We are in mid segment, not too big, not too small. So here, till now, I develop leader from inside out. Instead of just go for any helicopter landing in the organization, where a different thought process comes. So till that time, I just found leader should be not bold enough to hold the flag. Okay, I am leader. Now I am this much knowledgeable that I become a leader. It should be leader should always reflect on their work process, and they should perform even in the same capability or same capacity when nobody is watching them. So that is the my criteria of just finding leader inside the organization. So I think that is right now, this is the only bandwidth that we have. But in future, I need to learn lots of new skills, how to develop or even bring the different industry leaders inside the organization. That is going to be my learning curve in future.
Dr. Amit, you have been talking about the branding, growth, and sustainable business, means the commercial around the practice. Now, if we see today, very few people are investing into branding. However, many people are investing into marketing. And I have seen that your focus always remain on the branding. So can you explain it little more?
So, as we discussed earlier, the marketing is just about doing some propaganda in the social media or maybe the other tools to reach the patient. And you definitely attract the patient. But those patients, when come to your practice, they are not aligned what you want to deliver. So your most of the time goes into dealing with those kind of people where your ethics, your deliverable, your technology is not aligned with their expectation, their need and their demand, their aspirations also. So that's why we always focus on the branding part, because I want to own those kind of patient who can understand us also. So as I said in the start that I love craftsmanship, I love artistic job, I love technology. I want to deliver those kind of things to those people who at least value them. So I'm just creating those kind of world-class painting like Leonardo da Vinci or anything, and I cannot give it to anybody who has no worth. So that is my philosophy. That's the real truth philosophy. I want to serve those people who understand our work. To achieve those things, branding help us a lot. We exactly reach to those people who are searching for us, who need those kind of services that we are offering. And that is the big drift. It might be slow in the start, but you have no idea, and that is a very long life cycle. Start slow, 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 and suddenly it become boom. And in the marketing, it is just like a switch. Whenever you switch it on, the patient comes with lots of different aspiration. You get puzzled with those kind of scenario, and when you try to switch it off, everything vanish. So that is the my perception of marketing and branding in healthcare segment.
In contemporary time, when we are speaking about the commercials.
So it's always happens the same thing. So in healthcare, branding is the only recommended thing. If you want to do some marketing, that is the very small positioning of marketing when you are opening up in the new locality, a new location. That is the only thing that is required. Otherwise, you get stuck with those kind of people where your entire energy get drained.
What gives better returns today when we speak about the commercial? It is reputation, investment in technology, better interiors of the clinic.
Definitely reputation. So the interior of clinic, patient feel wow, okay, they come to the good clinic. Equipments, machinery that is helpful to make things understandable to the patient as well as the dentist also. We also understand, okay, this much of caries that is here in this particular tooth, and the patient can also see. So that, but as far as the other factor is concerned, the long term effect is not coming from these two factors.
You invest heavily into the technology. You buy the best on the planet which is available, and rather you are early on to buy them in India. Why so much of the investment when nobody is doing it? How does the technology make so much difference at this much of the premium investment?
This is the only one point before all kind of capital investment. Does it going to help our patient or not? I'm not buying this equipment for my sake or for my aspiration to equip the fancy equipment in the clinic. It must serve our patient. This is the primary goal. And that's why we never talk about what we have in front of patient or in front of other people also, because this is not meant to be sell. This is meant to enhance the quality parameter of our patient experience. So that is the primary goal. That's why these equipments are here. I understand the value. I understand what the ethos that real tooth have towards their patient, and that equipment is going to fulfill that or not.
कुछ एग्जाम्पल देंगे डॉक्टर साहब? जैसे आपने कुछ बताया था सक्शन हेल्प कर सकता है, इवन स्कैनर का क्वालिटी थोड़ा हल्का हो तो भी कंप्रेसर की एयर क्वालिटी से ट्रीटमेंट के आउटकम चेंज हो जाते हैं.
So I always explore how these kind of world-class equipment are helping each other to deliver better dentistry. Suppose people, lots of my friend and colleagues, juniors call me, we want to buy this scanner, but there's this kind of limitation in terms of scan अच्छा नहीं आ रहा है, सीटिंग अच्छी नहीं हो रही है क्राउन एंड ब्रिज की, और स्कैनिंग में बहुत टाइम लग रहा है. As far as scanning procedure is concerned, so first question I ask them, what suction that you have? Most of the value segment scanners have limitations to wet surface. They are good in dry surface. And if you have not a good suction in your chair, your tooth structure get exposed with saliva, and your value segment scanner is not capable enough to scan. Even the good scanners also, they scan it, but real data was again missing. So you need a relatively dry surface around the mind, and that's why you need a better suction. There are only few companies in India, and especially I think the Dental is the only company who give those kind of high-end suction equipment where feeling of using digital dentistry and the precision part of digital dentistry will be enhanced multifold due to the one good suction behind your chair. And that is the observation that we need to understand. Instead of blaming the scanner company, we should invest and retrospect our procedure. Okay, this is the limitation of this equipment. How the other equipment can synergistically help to enhance the potential of our equipment.
I never thought like this, and rather this correlation was never established, right? So this is good insight. I'm sure many dentists will get benefited out of it. Whoever has invested in any kind of the scanner or any other thing. Dr. Amit, is loyalty dead in modern dentistry?
So Dinesh, actually loyalty is not dead. Old version of loyalty is dead. The new version is something different. The old version is I'm staying with you because I'm grateful. And that applies for your teammates, your patients, your other staff. Hello. New generation loyalty is I am staying with you till the time you make me grow, you make me challenge, or you make me trust. So this is the new loyalty. And everybody should flow according to that. I don't think there is any challenge in that, because in this three aspect, we are pushing each other to grow further, being more accountable for each other and what we deserve. My first patient is still my patient. They can leave us also. I'm really grateful in my old thought process, but now I think differently that my first patient is still my patient because I added so much value in last 25 years that every time they come to us, we come up with the new technology, new tools. It will be more painless, more comfortable, more better experience. That's why they stuck with me since last 25 years. Same way in the team part or employee part, our older people after 10 years, 15 years, they are joining back to us because we also deserve something better. This is going to help them in grow further. So that is the combination of new meaning of loyalty. So the people who is always crying about the loyalty factor are those who don't deserve those things. We have to enable ourselves to deserve in a better version in terms of person, in terms of organization, so that new meaning of loyalty should be fulfilled for everyone.
This is a new definition for me. Quality of air really matters in dentistry. Can you just put some light on this, sir?
So in my college days, it always happens that uh, my colleagues, my seniors, my juniors, even my batchmates always complain that this composite fails. They did everything in a right manner, but it come out after 2 days, after 1 month, after 2 months. So they get surprised कि क्या किया. When I also come into that clinical part and I just found, okay, my feelings also coming out. Then I explored what was the reason. Then I found the contaminated air is the big challenge in all kind of restorative world. When I start my journey, the composite was in their initial stage. We don't have those kind of fancy 8th generation, 7th generation bonding agent right now. I started my journey with the 4th generation bonding agent, then 5, then 6, and 7, and now we have the universal bonding agent. Even in those bonding agent, the clean surface of tooth structure is very important. When your air get contaminated with moisture, with dirt, with oil, after etching, can you believe when you try to dry it, you are again contaminating the surface. And how any adhesive can be cemented on that? Before placing something, you are just placing the one Vaseline on top of that. So you are not preparing, you are just inhibiting that surface for bonding. So these kind of initial changes I just noticed, and you cannot believe almost 10 years in my journey, I isolated the surface and tried to dry the entire cavity either with sponge ball or chip blower.
Okay.
Before I had the dental sections and compresses. With Tornado 1 is my first one with all kind of external filters in that. So that changed the entire thing, even during the extraction and other things. So now we can use those kind of stuff in a very predictable manner, as we cannot use with any kind of economic, or you can say the Chinese section with the all kind of jugaad like structure. Fundamental structure of the clinic should be taken care first before we invest on more fancy equipment.
This is a big message to everyone. Investment is very thoughtful in clinics. Basics should be solid and they are very pertinent here. Now there is a hypothetical situation. Do dentists fear with the financial numbers, P&L, system development, or managing the people? And this inhibit them to scale up their operations.
Very true.
Is it? This is the fact?
This is the fact. And they ignore it because they don't want to see on those aspects. Okay, ये तो मेरा नहीं है. And they connect it with their ethical part कि अच्छा हम ऐसा हैं तो ऐसा नहीं सोच सकते. सबको वही जर्नी चाहिए. But without knowing that, you cannot crack the deal. At least you should slowly improve yourself along with your clinical skills on those domains where you can start. And it is not a rocket science, it's already written in the book. It is all about you should understand the entire philosophy and try to implement in day-to-day practice. I got opportunity to work with Dr. Schellenberg. So I remember he sharing his last clinical case of crown preparation. He told us that throughout their journey, he take impression. At that time, there's no digital equipment was there, so he take impression and make two models. And before every patient, he prep on the model before doing on the patient. And the person with such a legendary attire,
Yeah.
and they are doing and following protocol across the life, but somehow we miss that. So protocol should be protocol. It should not be corner cut, and things will definitely designed to work for us. We are responsible that things are not working for us. I follow this kind of philosophy and always stick to the books. I always go by the books, and it works for me. And definitely, it works for my entire team.
Should you become the best dentist in terms of skill, knowledge, and the treatment outcome, then you start developing your DSO kind of a ecosystem. As you grow yourself, you should parallelly take the ecosystem together.
Initial 5 to 10 years is to development of your core skills. That is very much important. So because in this journey to become a better version of your clinical manager like profile, so you should understand where there are lots of scope of missing out, or maybe the failure, or maybe the other factors before reaching to that aspect. So my message is first 5, 7, 10 years focus on clinical excellence, work for that, and then gradually shift your paddle into the next direction where you can balance both of them.
Great, good perspective. Now we are coming to this next segment of our conversation, which is the future of dentistry. I would ask you to share your wisdom as a closing remarks to the audiences. How do you see the dentistry is evolving, and what are the mega trends which will impact dentistry in long term, rather short term?
Right now, already disruption started in terms of digital dentistry. So digitally and with the help of AI integration, I personally found it's lots of blessing for entire fraternity. But if we think about dentist prospect, if they take it in a very healthier manner, so their journey cannot be affected by this kind of disruption. First is the modern dentistry is going to disrupt average level of skill. Either you have to be top level, but on the other side, average level dentists can perform better with help of these kind of technologies. You have to identify yourself in which type of journey you want to go. If you find yourself कि okay नहीं मुझे average level से ज़्यादा उस level पे मेहनत नहीं करनी है, adopt the technology in the right time so that your counterpart can be managed by the technology. And the complex skill set like profile, it has always been in demand. This cannot be disrupted by anything. This is the dentist aspect. Other aspect is the organization aspect. If you talk about Indian dentistry, whatever the understanding that I have, things are changing a lot. Lots of government infrastructure that is coming, and people awareness towards the oral health is also increasing. There's a huge scope, huge demand of digital dentistry, overall dental treatment in the market. Along with that, lots of government support, lots of cross-functional integration of dentistry, like with the trauma, like the plastic surgery, like the cosmetic one. So now people go for the skin and derma correction. Along with that, some veneers also. As you see in lots of Instagram reel in the Middle East and other parts, that's happening.
Dermatologist and dentist
are collaborate. So these kind of stuff that is coming up. So either you have to be ready or start collaborating with those kind of people who can work in the cross function. There's a huge scope, huge market that is coming up, and we should be ethically ready for those kind of market, because as fast this market is growing and we are not retaining the trust of our patient. So again, there's lots of turbulence in the market that will arise and that eventually affect the entire profession. Be prepare yourself for this kind of thing. Either you are in very highly skill set, you have very high skill set, so you can develop yourself into those kind of complex treatment specialist, and where you have to select your core specialty, or either go with the flow and adopt the technology in the early stage and do all the needful along with the lots of collaboration. That will definitely going to help.
You mean to say with the AI and other technologies coming at a prominence, average dentist will become redundant?
So that can be better supported by tools. They have to start using technology in an early stage.
If they don't adopt the technology, then they are out of the game. If they accept the technology, then they will grow with the curve.
I want to see every dentist in a very flourish manner.
Yes.
So that is my perception. I cannot use those kind of negative words where they cannot flourish. They can flourish. Why not they should flourish? So if you are deficient in certain part, the technology is here to help you out. Adapt it before you sabotage yourself. Use technology to help you to grow faster.
There are many budding dentists. They are in their early, you can say 20s.
Yeah.
If somebody comes, or I would rephrase it, if somebody has grown up watching you in your neighborhood and he just want to become like you, and just after completing his education in dental, he comes to you and say, just give me the guru mantra कि मैं आपकी तरह बन जाऊं, तो क्या बताएंगे डॉक्टर साहब?
Invest on yourself, invest on your team, invest on changing your mindset for industry. So these three factors that you can change from inside out, that is your accountability. Apart from that, everything you can manage.
Just strong message. Now, for the masses, not just for the 25-year guy, but all the young guy, what one thing they should stop watching out to grow in dentistry, and what is one skill where they should double down to accelerate their growth?
This depend upon person to person, but most of the time you should focus on your core skills. Most of the dentists want to do dentistry in all 360-degree way. They want to do endo, implants, restorations, smile designing and everything. So that is not possible. Find your core skills and nurture that core skill to that level that you can serve patients in a very ethical way or very perfectionist way. So I think that is more than sufficient for any dentist. A dentist must ignore the multitasking approach. They should focus on what matters for patient and for himself instead of chasing those aspiration which is not robust. Don't try to be a Facebook or Instagram like dentist from the day one. This is fake. This is not practically possible. You can see only one side of the screen and you have no idea what's going on after 1 month, after 3 months, or after a year time. So just focus on the fundamental. There are lots of things as per book that is still unexplored. So please focus on those skills and definitely things will move back to you. There's no hard and fast
The
science.
skill with a lot of fanciness will certainly help, but only fanciness without a skill
Without a skill is not
will
going
not
to
help them. You have achieved a lot of things at a very young age. I can still see the fire where you want to learn, you want to develop people, you want to contribute in the growth of the Indian dentistry. How do you define a legacy when you turn 70, 80, or 90, which you build for yourself?
Definitely, I from early days, I just want to build those kind of organization that will exist after me. Initially, the typical process is calling your son, your daughter, your family persons to be a stakeholder. This is not correct. So, what I am doing, I am developing all layer of team in every 3 to 5 years.
Okay.
So before my son will join me, he already come across 6 and 7 different level of leadership. He is already been built in the organization. So the legacy should not continue after 20 or 30 years. It should be churn around time, should be not more than 5 years for me. That's how we did till now, and hope in future also will follow these things. It's all depend upon my downlines, how they develop their leadership inside their funnel. What I want to see is I can see up to 2042 where I decided to retire. After that, there are lots of parameters that I already defined in terms of many factors. But I'm not a very rigid person. It will be flexible as per society demand, as per patient need. So my legacy system is not about anything very robust and that should be stick to that for a longer period of time. It should be very adaptive, but some basic core values should not change. So that is my message to my leadership. So just sustain with the core values. And if you want to change the core values also, just think at least 10 times before touching them.
Yeah. So this has been rewarding all your system, core values, and whatever the ethos you develop for your organization, and you want it to continue, whether you are there or you are not there, or you are just working in a non-executive role. Perfect. This was really wonderful discussion. I enjoyed it thoroughly. I learned a lot, not only about the product, about the ecosystem, how the dentistry work, and how the new concept in India, which is already established globally, the DSO model is evolving here. I hope our audiences have also enjoyed it. There are many aspiring dentists, they will take good leads and they will take their journey forward. Thanks to everyone who have invested their time watching this episode till end. Discussion with Dr. Amit Anand would have surely created some of the meaningful insight which will enable the young and aspiring dentists to shape their career. For the patients who are watching this episode, they will use these insights to select the right dentist, select the right clinic and right DSO to brighten up their smiles. I request you to please subscribe and stay tuned on this channel. We are just expecting some more exciting and engaging discussions from the world of dentistry for you. Your feedback is very valuable to us. Please do write to us. It will help us get better and serve the community in much improved way. Thanks a lot.